The influence of genomics in clinical practice has created a new vision about the way of perceiving pathological and physiological changes after learning about the influence of genetic variations on diseases and health. To produce a high-quality genetic report that is of maximum utility in the clinical field, geneticists need information about the patient's clinical phenotype, which is stored within the medical record, but in an unstructured way. This requires geneticists to spend a significant proportion of their time searching, identifying, and coding the patient's phenotypic characteristics within that medical record. Generative artificial intelligence has demonstrated its ability to understand free text, even being able to interpret clinical texts in different languages. With the use of Amazon Bedrock, which offers generative AI models in a managed infrastructure and a pay-per-use service, extracting the different phenotypic characteristics from a patient's medical record, and even coding them according to the human phenotype ontology, commonly known as HPO codes, becomes a true opportunity. Let's see an example. Introducing free text in this text box, this solution is designed to be integrated with a medical record and so be consumed from those applications used in the day-to-day genomics field. The system will display the possible pathology to which this patient corresponds, as well as other possible ones to consider, and will provide recommendations for the checks to rule them out using differential diagnoses. We can see how a list of phenotypes found is displayed, their coding, as well as the evidence that suggests them within the clinical text, so that the clinical professional can, in this case, decide whether the information provided is relevant to the case, or, on the contrary, prefers to discard it. Diving into vulnerable populations such as pediatrics, the rare, most missed diagnoses and misdiagnoses can cause children to miss the best treatment window. In recent years, there have been great breakthroughs in clinical research on these rare diseases. The development of numerous targeted therapeutics has provided promising results for patients. However, considerations in vulnerable populations make timing and accuracy a critical indicator for better care. Let's look at an example of a pediatric medical history text from a patient with a rare disease, Prader-Willi syndrome. The system will begin to analyze the information in detail to extract the traits and symptoms from the text, obtain their HPO code, and locate the information within the text. Additionally, it is able to provide a reference on which it bases its response, in this case linking it to the human phenotype ontology. It is also able to suggest a possible pathology relating to this clinical phenotype and other possible diseases to be checked, and the mechanism to rule them out, providing the professional with much more information to help them to be more efficient and accurate in diagnosis. One of the most impressive capabilities of generative artificial intelligence is how it understands human language, even in clinical texts. This can be clearly seen when it interprets phrases mentioning a positive change in body mass index or 4+ tonsils. Also phenotypes such as weight gain or hypertension. This far surpasses previous artificial intelligence technologies. A genome-driven approach in combination with a detailed clinical phenotyping improves diagnostic yield over that with previous standards of care. Let's make it happen.